Hi, this is Sherry with ATL Clinical Workshop, and today I want to give you 5 common mistakes made at the medication lab simulation. So that way, hopefully you can incorporate something different when you're practicing, so you make sure you don't make these mistakes when testing. So one of the first things is not IDing your patient. And it is crucial that you ID your critical elements on your scoring tool. Tells you you have to ID your patient immediately before administering a medication. Mistake number 2, if you're doing a secondary or an IV push, that you're not checking the IV site before and after you administer the medication. And when you're checking that site, you're checking for redness and edema. You have gloves on when you're checking, and it has to be done before and after. So students are forgetting to do that follow-up on the site to make sure that it's still good. The other thing is forgetting to gel your hands. You know, we gel our hands in the beginning before we grab any medications. If we put gloves on, when those gloves come off, we got to be sure to gel after that. Third thing, or fourth thing now, make sure you get your calculations correct. You know, sometimes when we get nervous, we may not be dyslexic on a regular basis, but when we get nervous, it's like we're rearranging numbers and adding wrong. So use your calculator and set up your formula and punch in those numbers, and then do it a second time to double check that you are correctly coming up with the right amount of medication. Those patients count on you to be accurate. And then the 5th mistake is landmarks for your IM injection. Landmarks are crucial. Get in your fundamentals book and look at the landmarks and practice those over and over. So there's your 5 tips on common mistakes that are made during the medication station. For more information, visit our website, www.atlclinicalworkshop.com.